So I'm talking to Dr. Shavit, Associate Professor of Family Medicine at the University of California in San Francisco, and the Executive Director of the Transitions Clinic Network, a national network of community clinics which specialize in providing care to chronically or returning prisoners.
So it's important to share information between correctional and community health systems because it improves the care of the patients that we serve. So for instance, it improves continuity of care between the prison system and the community. It reduces costs by not having providers repeat tests that might have been done once patients were seen in the prison system. It also can reduce medical errors so that providers in the community have a better understanding of the treatments that patients received while they were incarcerated. Overall, that can lead to improved quality care and also improve access to care for our patients. We also know that it helps improve public health, as oftentimes communicable diseases are identified and treated in the prison system. So the current state of sharing of health information between corrections and community health systems currently is very poor. It tends to be inconsistent where prisons and communities don't have good systems of sharing information. Providers may try to access information but cannot do so on a regular basis. Oftentimes it's untimely. By the time the providers in the community receive the information, so much time has passed that it's really not relevant to the care of the patient, and it's not well systematized. Some of the information that the community is getting can be variable, and sometimes it's relevant information to the patient's care, and other times the information is not relevant. One good example is that oftentimes when patients are in the prison setting, they're taken outside the prison to community settings for treatment, for instance, hospitalists or specialists, and oftentimes that information is not included in the patient's medical record when it's sent from the prison to the community. Some of the other problems with sharing between the prison and the community is that if patients' consent and confidentiality is not protected, it can lead to mistrust for patients in the community and real disempowerment. So in the prison setting, because patients don't have fidelity or the right to confidentiality of their medical records, and they also have a loss of autonomy, which means that they do not always get to consent to who shares their information, patients learn quickly that they can't trust the medical system in the prison system. And unfortunately, that mistrust and that real disempowerment on people really not having control over their information really kind of bleeds into people's experience in the community. When patients come to community settings, they're already mistrustful of the healthcare setting from their experiences in prison. And because of that, they really are not empowered. They don't feel in control of their healthcare, and it's really detrimental to them being activated patients to really sort of being the driving force behind their own healthcare. Strategies for information sharing that can empower patients and foster their autonomy include creating systems that make sure that we provide patients opportunity to consent. So when we're sharing information between systems at every turn, we should be reaching out to patients to understand their wishes and how we want to share that information. It's also important that we prioritize confidentiality in these settings and making sure that we do whatever we can to make sure that we protect patients' information and that it remains confidential. And in that way, they will move to trust our system more and be better advocates for their own health. Some of the other strategies that we recommend for creating systems for sharing information are including transparency. It's important for patients to be able to access their medical records and really know what information is in those records. And that includes notes from the providers that patients should be able to understand what's happening with their health and be able to see that information, not just while they're in the community, but also while they're in the prison system. We want patients to have the opportunity to correct their records if there are errors. They should also have the ability to make those corrections. And some other strategies that we think are important are activating patients, really educating them to understand better what's going on with their health, to know what's in their medical record, how it pertains to their own health, and really what are the next steps of care once they reach the community. I don't think that it's necessary to have an electronic health record or an automated system to provide patients with access to their health information. I think it's a tool that's very useful that will solve some of the issues that we have in information sharing. For instance, it makes things more systematized. It's easier to access the information. We can access the information much more quickly, but I don't think that it's a requirement, and I think it's actually a great tool that we can use, but it's also important to create other mechanisms by which patients can access their medical record, because it's important to realize that not all patients will have access to the internet or to computers. So some of the systems that we create now in the community for patients to access their information, which we call patient portals, may be difficult for our patients to access in the community. So it's also important that we create other mechanisms by which patients can get their health information in a timely and effective manner.